So we'll call the meeting to order. Can we get a roll call, Ms. Stemper? Or Mr. Ferris?
Chief Linville?
Here.
Dr. Lyon?
Here.
Leslie Wilmer?
Here.
Tyler Wetzel?
Here.
Sheriff Youngblood?
Here.
Orchel Crier?
Here.
John Surface?
Here.
Peter Brandon?
Nope, say it again.
Here.
Maribel Reyna?
Here.
And Dr. Franklin?
Here.
We have a quorum.
Thank you. Could everybody rise for the flag salute? Sheriff Youngblood?
Salute, pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, sir. Sure. Consent agenda. All items listed with a CA are considered by program staff to be routine and non-controversial. The CA represents the consent agenda for the board members of MCAB. Consent items will be considered first and may be approved in one motion. If a member of the audience wishes to comment or ask questions regarding an item or items on the consent agenda, they may do so prior to a vote being taken on the consent agenda. A member of MCAB may remove any item from the consent agenda, and it will be considered in listed sequence with an opportunity for any member of the public to address MCAB concerning the item before action is taken. Is there anybody that would like to discuss any of the consent agenda items? Nobody from the board, from the public? Do I have a motion to?
Youngblood motion on consent.
Second?
Second.
Do we need a roll call? Can we get a roll call, please?
Chief Linville?
Aye.
Dr. Lyon?
Aye.
Leslie Wilmer?
Aye.
Tyler Wetzel?
Yes.
Sheriff Youngblood?
Yes.
Orchel Crier?
Yes.
John Surface?
Yes.
Peter Brandon?
Yes.
Maribel Reyna?
Yes.
Dr. Franklin?
Yes.
Motion passes.
Thank you. Public presentations. This portion of the meeting is reserved for persons to address the board on any matter not on this agenda, but under the jurisdiction of the board. Board members may respond briefly to statements made or questions posed. They may ask a question for clarification, make a referral to staff for factual information, or request staff to report back to the board at a later meeting. Also, the board may take action to direct the staff to place a matter of business on a future agenda. Speakers are limited to 2 minutes. Please state and spell your name before making your presentation. Is there anybody that would like to make a public presentation? Seeing none and hearing none, we'll move to board member announcements or reports. Board member announcements or reports on their own initiative. Board members may make an announcement or report on their own activities. They may ask a question for clarification and make a referral to staff, or take action to have staff place a matter of business on a future agenda. Going once, going twice. Thank you.
Mr. Chair,
Yes, sir.
just want to make sure we get in the record that May 19th is the start of EMS week, and that's why we're all here, and I think it's important that being the official record.
Thank you, sir. Good point. Manager's report. Mr. Ferris?
Making sure it's on. I don't want to get in trouble.
I was going to call you on it.
I know you were. You were waiting, weren't you? Okay. Thank you, Mr. Chairman. 2023 began with the county still in the fog of COVID-19, with call volumes remaining high and offload times increasing. Personnel shortages still had an effect on all aspects of the EMS system, causing Hall to continue to subcontract with other local ambulance providers, as well as to bolster their ranks with out-of-state medics and EMTs. 2023 saw the emergency declarations of both the state and local governments lifted and the return to normal operations. EMS continued to work with our providers to increase the use of Tele 911 and the FlyCar system in the greater Bakersfield area. We began the implementation of the redirect system that would eventually automatically redirect ambulances from hospitals that were showing specific signs of increasingly delayed patient offload times. In 2023, the operations staff made significant changes to the EMS system by updating the EMS personnel accreditation policies, along with multiple other policies, procedures, and protocols, promoting more jobs in EMS, expanding scope of practice and capabilities in the field, and instructing citizens of Kern County on basic resuscitation. Our team not only made its presence known throughout EMS, but also within our metro, urban, and rural communities. Throughout the year, the operations team trained a total of 755 citizens on the use of hands-only CPR, and an additional 600 individuals were trained in the use of Stop the Bleed and how to control a life-threatening injury as a layperson. We also implemented 116 emergency medical dispatch code changes by downgrading 89 responses to no lights and sirens and upgrading 27 responses to lights and sirens, as identified in a careful review of 2 years' worth of data. EMS staff audited 654 patient care reports, with 75% receiving an A grade, 21% receiving a B grade, and 4% receiving a C grade. 1,307 EMTs, 158 paramedics, 48 mobile intensive care nurses, 11 emergency medical dispatchers, and 5 paramedic preceptors were all accredited by our certification staff. In 2023, we saw all of our work and changes to the system come to fruition as ambulance response times improved 86% from January to December. In April, EMS participated with Bakersfield College in their Public Safety Open House, working alongside multiple agencies to organize a public safety event, and on August 30th, EMS held a job fair in response to the grand jury report. The EMS Preparedness Program released $114,650 in grant funds to members of our Kern Coalition. Both EMS operations and emergency preparedness, along with public health, assisted the County Emergency Operations Center during the flood threats to 2 large medical facilities along the river. Working closely with both facilities, we ensured they were ready in the event the water crested the riverbank. Emergency preparedness secured funding to purchase some large items for county preparedness, including 2 100-kilowatt generators and a mobile command unit that will be deployed to incident locations and large events. We expect to take delivery literally any day now. And finally, we added 2 new staff to our EMS family in 2023. Robert Lopez handles our paramedic and emergency medical dispatch accreditations, enforcement cases, as well as pulse point verification and STEMI designations. Tori Yip was hired to handle the management of the EMS and public health warehouse. Tori handles the day-to-day management of the warehouse using the WASP software system, assuring the accountability and readiness of all of the equipment and supplies. In 2024, we anticipate further protocol and procedure updates, continuing public outreach and education, receiving and implementing the use of the command unit, and creating a county and region-wide communication plan. This concludes my report. It is strongly recommended that my report be received and filed, and I am available to answer any questions at this time.
Thank you, Mr. Ferris. Any questions from the board or the public? Seeing none, do we have a motion to receive and file?
Motion.
Second? Second. Thank you. Can we get a roll call, please?
Chief Linville,
Yes.
Dr. Lyon,
Yes.
Leslie Welmer,
Yes.
Tyler Wetzel,
Yes.
Sheriff Youngblood,
Yes.
Orchel Crier,
Yes.
John Surface,
Yes.
Peter Brandon,
Yes.
Maribel Reyna,
Yes.
Dr. Franklin.
Yes.
Motion passes.
Thank you. Mr. Ferris, back to you for the APOT Task Force report.
Thank you, Mr. Chairman. The quarterly APOT Task Force meeting was held on April 25th with representatives from Public Health EMS, Kern County Fire, Hall, and Liberty Ambulance Services, along with Adventist Health and Dignity Hospitals. EMS gave our report, which included the total number of APOT hours. In the first quarter of 2024, APOT hours totaled 9,607.3, with all hospitals in the system operating at well above the 10% greater than 30-minute expectation as outlined in AB 40. It appears that staffing, transport volumes, the misuse of the 911 system, and some internal hospital systems are continuing to play a role in the ongoing delays. If you recall, I shared with you that EMS, working with First Watch and ReadyNet, created a bidirectional communication system at the request of the hospitals that provided the hospitals with the opportunity to have some input in the APOT times when the patient is actually offloaded onto the bed, by allowing them to log in and log the transfer of care time by simply pushing a button on their computer screen. I presented a report from March of this year showing hospital participation in the First Watch ReadyNet bidirectional link for transfer of care button usage. For the month of March, Adventist Health Tehachapi had the highest percentage of use with 56.91%, or 173 button pushes out of 304 patients transported to their facility. Adventist Health Bakersfield had a TOC percentage of 35.96%. Adventist Health Delano had a transfer of care percentage of 2.53%. Bakersfield Heart Hospital had a transfer of care percentage of 46.43%. Bakersfield Memorial had a transfer of care percentage of 48.02%. Kern Medical had a transfer of care percentage of 51.59%. Kern Valley Healthcare District had a transfer of care percentage of 0%. Mercy Hospital was at 5.90%. Mercy Southwest was at 9.90%, and Ridgecrest Regional was at 0.83% usage. I explained during this meeting that at the current rate of use, I cannot use this data set in calculating the APOT scores. It should be noted that EMS is now moving to an automatic clock stop system through our electronic patient care provider, ImageTrend, that will stop the APOT clock when the electronic device is signed by the nurse receiving the patient. If you recall, this is one of the mandates for the state EMS authority in AB 40. Once fully implemented, EMS will be able to run a report to determine the exact APOT time based on the time the ambulance arrived at the hospital and the time the nurse signs receiving the patient. During the roundtable, Heather Van Housen from Adventist Health Bakersfield discussed the changes to their main entrance to the emergency room and that she expects to see their APOT numbers decrease next quarter. Additionally, other facility representatives stated they would bring the transfer of care button push issues to their ER staff members. That concludes my report. It's recommended that this report be received and filed, and I'm available to answer any questions.
Thank you, sir. Sir, any questions or comments from the board or the public? Hearing none, do we have a motion to receive and file?
Youngblood motion.
Thank you. Second?
Second.
Thank you. Can we get a roll call, please?
Chief Linville,
Yes.
Dr. Lyon,
Yes.
Leslie Wilmer,
Yes.
Tyler Wetzel,
Yes.
Sheriff Youngblood,
Yes.
Orchel Crier,
Yes.
John Surface,
Yes.
Peter Brandon,
Yes.
Maribel Reyna,
Yes.
Dr. Franklin.
Yes.
Motion passes.
Thank you. Adjournment. The deadline for submitting public requests for the next MCAT meeting is Thursday, July 25th, 2024 at 5 p.m. to the EMS program manager. We will adjourn to Thursday, August 8th at 4 p.m. at the Kern County Administrative Center in the Kern County Board of Supervisors chambers at 1115 Truxton Avenue. Do I have a motion to adjourn?
Motion.
Thank you.